All right, we're good to go.
Thank you. I would like to call to order the Long-Term Care Committee of Management meeting for May the 7th, 2025. I am Vice Chair Sue Patterson and will be chairing until Chair Scott Mackey is available to attend. At this time, I'll ask if there's any declaration of interest. And seeing none, of course, if one should arise during the meeting, you may declare it then. We do not have any delegations today, so we'll move on to item 4, which is items for direction or discussion. And we have report LT CRCM 0825. It is the long-term care director's update for March the 1st to April 30th of this year. And it is going to be presented by Jennifer Cornell, our Director of Long-Term Care and Senior Services, and Jen takes over. So if someone would like to move it, Councillor Carlton, seconded by Councillor Keaveney. Thank you. Jen, the floor is yours.
Thank you, Vice Chair Patterson. I'll just pull my notes in front of me. So this is the director's update covering the period of March 1st to April 30th. And as always, there was a lot going on. So I'll get right into it. Number of ministry updates, an announcement from the Ministry of Long-Term Care announcing that they'll be utilizing remaining reserve funds to support the salary and benefits for IPAC leads in long-term care homes. And the distribution is outlined here in the report. And so that is good news because the funding for the IPAC roles didn't quite match the cost of the roles. So it's appreciated from operators. The ministry also had asked for feedback on their fairly newly launched compliance assistance program. And they had completed a survey. All 3 of our homes participated in providing that feedback. And we look forward to hearing more about how that program is going to evolve. A number of us were at the Advantage Ontario convention last week and heard some updates from the Ministry of Long-Term Care specifically about compliance assistance. And it really feels very hopeful and promising that we're moving in the direction of the Ministry of Long-Term Care and long-term care operators being on the same team with the same vision and goal, which is to provide excellent and safe quality care for the people that are living and working in long-term care. And this assistance program reminds some of us that have been around a while of the old days where inspectors were advisors. And so what the Ministry of Long-Term Care is trying to do, which we fully support, is find a nice balance between the need to do inspections, because that is their role, is to hold the standard for quality and safety. And so they need to be doing that. And they have this unique opportunity to have the 30,000-foot view of all of the long-term care homes in the province of Ontario to see the areas and trends where improvement is needed, but also where is their best practice, where is there excellent programs and good work happening, and how might they support and in the spreading of that good news. And the Minister of Long-Term Care, Natalia Kusendova-Bashta, spoke at the convention, and what part of her speech was, or her remarks, was about getting the good stories out there, and that the media often gravitates towards the bad news stories, and how can we balance that with the good news stories. So this feels very promising, and we're heading in the right direction, I think. For everyone involved in long-term care. They also, ministry provided an update regarding funding for laboratory services, and that they're going to continue providing additional funding for reimbursement of phlebotomy and related services until this time, well, just end of March next year. Another update regarding the staffing increase funding, which is also called the direct care funding. It has a couple of different titles and it's evolved a little bit over the years. And part of the Minister of Long-Term Care's remarks last week also were that we're almost there as a province. So remember, it's a 4-hour target of direct care average across the province, and her remarks reflect that we're almost there. So that's good. An update on the PSW permanent wage enhancement funding continuing to be supported. And finally, an update on the fee per bed funding around pharmacy support and pharmacy services. So those, if you want more details about those items, they are linked in the report. For family updates, we continue to feel that it's really important to keep our family members up to date and have opportunities to engage and provide us feedback. So we held our virtual family call at the end of March, and the link to that video is there. And a special thanks to Rob for always co-hosting those virtual family calls. Infection prevention and control. Public Health Ontario has updated their website with new infection prevention and control resources specifically for long-term care and congregate living settings. And so we have access to those and have been implementing them and embedding them into our daily work. They also have developed a new resource outlining IPAC best practices in home and community care settings, and tools to go along with that. And then there's been lots of activity and discussion around measles exposure and measles in Ontario. And so there are some links to some information there. And we continue to support our team members in the steps they can take to be sure about their vaccine status. And for many of us, it's a little bit of a scavenger hunt to find the information of what our vaccine status is and to be able to show that when and if we need to. Staffing and training. We welcomed a number of either new leaders or leaders into new roles across the 3 homes, and they're highlighted here in the report. Also just wanted to share with committee that as under the Act, every licensee needs to ensure completion of specific training and education to staff who provide direct care to residents. This includes medical directors, physicians, registered nurses in the extended class, which is our nurse practitioners. And so we have included that group in receiving our annual education handbook. We sent that out in April, and that helps them to be able to stay up to date with that mandatory education. Just for your interest, the rest of our teams have access through an electronic platform. It's Surge Learning, and we house all of our education there and are able to assign them appropriately to the different team members. And that's how we're able to track that mandatory education for the rest of our team members. We are preparing next week. We are going to have one of our long-term care leadership days where we have all of our long-term care leaders across the 3 homes and our leaders and partners in our partner departments, so finance, human resources, information technology, and communication departments, join together. We love that we can meet at Sydenham campus. And although we are in a pretty tight geography, it's not very often that we all get to come together. So really looking forward to that. It's about 50-ish people that come together to share and learn together. And we have a guest speaker, Penny Poucha, who is a leadership expert from Instincts at Work. And she's presenting the power of leadership, thriving in a complex world. And we were coming up with that well over 6 or 8 months ago, and I can't even believe how much more complex the world is, but here we are. So that's good. We'll all be ready to take things head on after May 15th. Wellness continues to be a feature and an important value that we hold in our organization. And so the second edition of our staff wellness newsletter will be released at the end of June. And we often link that in our reports to committee so that you will be able to have a look at that when it comes out. Partnerships. Lots of activity going on locally, regionally, provincially. I mentioned earlier, a number of us attended the 2025 Advantage Ontario Convention. I, along with the Prep LT student placement coordinator, Stephanie, who you saw present the Color It Coach program at our last meeting. She gave a presentation. We're really excited to be invited to receive an award. And so we also invited the Color It Coach captains, so some frontline team members from across the 3 homes. And I'm really pleased to share with committee that Grey County's long-term care Color It Coach program was honored with the prestigious Advantage Ontario Innovation and Excellence Workplace and Quality Award for outstanding work. And so we were able to attend the opening ceremonies and receive that award. And this recognition highlights our exceptional commitment to fostering workplace excellence through innovative strategies in health and safety, staff development, student mentorship, recruitment, and retention. And it's a testament to our Color Your Way promise and acknowledges the hard work, dedication, and innovative spirit of each member of our team. And I was really, really pleased to be able to accept that award along with the Color It Coach captains who came down to Toronto, went to Toronto. And it was really exciting and an honor to be able to receive that acknowledgement and also acknowledge the captains who, along with Stephanie, really have brought that program to life to make it as successful as it is. And then Stephanie and I presented an education session at the convention on the Friday. So that was on the Wednesday. And on the Friday, we had a full house to hear the nitty-gritty about what the program looks like. What does it actually look like in operating land, and how might other long-term care homes partner with Prep LTC or take some of our experience and implement it in their own homes. So really exciting. And that's my report.
Thank you, and congratulations on being recognized for all your hard work. And you make it sound fun. It doesn't seem to be too hard to do because everyone makes it fun and you're successful. I'll open it up for comments or questions from anyone. And I don't see any hands raised, so I will call the question for report LTCR CM 0825. And I guess I can just say any opposed. And again, I don't see any hands, so I will consider that carried. The next report is LTCR CM 0925. This is the long-term care operational report from February 15th to April 14th. And it is brought to us by a number of people. And Jen, will start as soon as I get a mover and seconder. And I will take Councillor Hutchison and Councillor Carleton. Thank you.
Great. Thank you, Madam Vice Chair. So this is our operational report for that period of February to April 14th. And I'm introducing the report, and we'll cover the quality section, and then I'll pass it off to my colleague, Dena. So quality, wanted to just talk a little bit about this. We have our updated information from the publicly reported indicators. And so you'll see the charts here in your report. And I just wanted to remind and provide a bit of context that this information is 6 months old already. And we started talking, well, we've been talking about it for a while, but we'd had some really in-depth conversations in November about these numbers, these indicators, and the, the variety of ways that we're approaching the differences between the three homes, the making sure that we're looking at data in the same way. We are actively implementing the clinical pathways, the best practice clinical pathways, which will have an impact on these numbers. And so you'll see a shift in a positive direction. The numbers are still, in many areas, are still red, which means they're higher than the provincial average, but showing an improvement from the report before. But again, it will take a period of time to have any significant change reflected in these numbers. I say that, and then I add a further complication that we are actively embarking in a change in our inter-RAI system, which is the documentation system that we use to gather data that feeds to CIHI, which someone help me, Canadian Institute for Health Information, that then takes all of the numbers, the data from Grey County's 3 long-term care homes and all of the other long-term care homes in the province and feeds it back to us in the data that you see in these charts. That program is shifting, and we're implementing a new program. About 100 long-term care homes in the province have already made that change. Lee Manor is actively doing the education and preparation to go live with the new system July 1st. Rockwood and Grey Gables will go live January 1st, 2026. And we're still sorting out what that significant change means to the publicly reported indicators and the data and what that's going to look like. So, and then I'll also just say a reminder that these numbers, while important, are one piece of the whole quality picture to reflect how a resident and our family members' experience is in long-term care. I mean, particularly residents, but when we talk about quality, we look at the whole picture of the overall experience for someone living in long-term care. There is some verbiage underneath the charts for each home, highlighting areas that the teams have been focusing on and aligning with the clinical pathways. And then I'll maybe just leave it there and see if anybody has any questions.
Okay. Any comments or questions for Jen? I don't see any hands, Jen, but I really do like as you say it, the verbiage below. That's very helpful.
Good, and we'll continue to do that. The ultimate goal of these operational reports are to make sure that as members of our governance, you're informed, and because they're public, also it helps inform the public about areas that we're working on. So we'll continue to add that information, and I'll pass it over to Dana.
Okay, good.
Hello. Good afternoon, and thank you, Madam Vice Chair. I'm going to give a bit of a clinical update from our highlights in the report. So Grey County's long-term care homes continue to benefit from our strong medical leadership provided by our medical directors, with Dr. Van Ziel at Lee Manor, Dr. Pillish at Rockwood Terrace, and Dr. Matt Cole at Grey Gables. Each year, the medical directors are required to submit an annual report, and they reflect on items from the previous year and opportunities that they see for the upcoming year. So today I'm going to provide a summary from their 2024 reports, and you'll find their full reports in your package. They highlighted in 2024, it brought some notable healthcare system changes, and in particular, the closure of the Durham Hospital's inpatient unit, which did impact on some physician coverage at Rockwood Terrace related to the emergency department. But thanks to a smooth transition and support also from some nurse practitioners, which were new in 2024 and now serving all homes, care continuity was maintained. And Lee Manor also piloted and continues to pilot an effective 24/7 on-call coverage model, again, supporting resident care in 2024. Some key highlights noted in the reports, and in particular Dr. Pillish, with the ability to be there as part of the groundbreaking ceremony with Rockwood Terrace, the redevelopment work. The implementation, as Jen has alluded to, of the RNAO clinical pathways, and we've been engaging our medical directors in that process from the beginning, and they're realizing some of the benefits as well. The Accreditation Canada success, which was very supportive, and improved communications with physicians and team members with the secure conversation tool. And at the last medical director meeting, they again echoed that as being a great success for timely, private, and responsive back and forth conversations. They highlighted some of the challenges of respiratory outbreaks noted, but the medical director shared they were well managed. And they also flagged Grey Gables made strides in reducing antipsychotic use. As Jen said, you will not see it in this current report, but some real, engagement of the medical directors and making some changes. And in that one in particular, towards a safer, more person-centered care, even recognizing as we've shared in the past with our behavioral support transition unit, there are some unique challenges along that way as well. In 2024, they look forward to meaningful progress with resident care with the implementation of our new clinical pathways. And we just rolled out March 27th, the Falls and Pain. And we happen to be here in Toronto with our team members, our frontline team members, working on the palliative care and end of life. And I'll tell you about the engagement of our frontline team members. And I'm feeling it here, Jen. You're going to feel the passion, and to the ED group and everyone else, you're going to feel it when they get home. And also the new Inter-RAI assessment system. They also thank the dedicated staff and collaborative leadership teams, and that's something we hear often, and it just echoed in the reports that they really feel the passion of our team members. So now I just want to give an update about our skin and wound program, again, supporting some of those quality indicators. But in Ontario, skin and wound care is governed by the Fixing Long-Term Care Act and associated regulations requiring all of our homes to have comprehensive evidence-based programs. So we're doing that with best practice. And this year, we also had several quality improvements made across our homes. The first one, in utilizing integrated technology solutions funding, we implemented Point Click Cares, that's our electronic medical record, at the Skin and Wound app, which improves documentation, communication, and decision-making through real-time data and photo tracking. And we're also able to share these photos to our physician through technology securely, and they can see the progress or sometimes challenges of skin and wound as well. And we can see progress along the way, and it's quite a unique tool, and it's very well received by our frontline team members. As well, Rhonda Rowley, an RPN and skin and wound lead at Lee Manor, has been asked to join the RNAO's Ontario Provincial Clinical Pathways Group to develop a standardized skin and wound pathway for us for long-term care in the province. And that speaks volumes, I think, to the way they're rolling these out. And Kelly Burke, a PSW from at Lee Manor, was only one of 200 PSWs across the province selected for ministry-funded skin and wound care programs. And her reply after receiving her certification and the passion she has is only going to serve everyone in that home team. So she's very enthusiastic about it. But these efforts are helping us improve care, strengthen compliance, and use technology to support resident health. So that's the end of my clinical update.
Any questions or comments for Dana? Again, you're making it sound very interesting and exciting. Thanks,
It
Dana.
is. Thank you.
Yes.
I'm enjoying it. It is exciting.
Yes. Okay, next is Karen.
Thank you, Madam Vice Chair, and hello, everyone. Rockwood Terrace was the only home who experienced a visit from the Ministry of Long-Term Care during the reporting period. An inspector attended the home March 26th to 28th to conduct a review on a critical incident, and always they review infection prevention and control while they're on site. And I'm pleased to report there were no findings of non-compliance related to that visit. Also, just wanted to highlight the critical incidents that were reported to the ministry during this period. As you can see, they're listed there. Just want to note a couple things. Disease outbreak Just wanted to note that sometimes we can have two happening in one home because they're in different home areas. That's done purposefully so that if one home or one area of the home can be cleared before the entire home, that benefits the staff and the residents. So that's something we like to do. So it could mean 1, 2, or 3 home areas in one home. But certainly all homes have experienced outbreaks this spring. Also, just want to highlight the graph there related to people. Pleased to report we're onboarding in some cases more than we're losing, and in some cases we're breaking even, so that's good. We continue to support a large number of students, not only college students who are doing their PSW or RPN certification, but also a number of co-op students and nutrition management. We had a nutrition management student here at Rockwood over the spring. So, and that, of course, is in conjunction with the Prep Long-Term Care and Color It coaches. And that's it for me.
Okay, any discussion? We're a quiet bunch today. But you know, when you look at that, that's because the reports are thorough. So, all right, next will be Tolene.
Hi, thank you, Madam Vice Chair, and good afternoon, everyone. So I was just going to quickly talk about the projects and locations and events section, as well as the occupancy. So I don't really have a whole lot to highlight about the projects, except, you know, whenever there's Valentine's Day and Christmas and Easter and all of those events, we usually make a big splash, and March with St. Patrick's Day was no different. So I think, you know, it's just fun to remember the joy and the way we try to bring a fun experience to the residents in long-term care. So all of the homes participated in green events, whether it was with pots of gold or whether it was with people dancing and putting on music shows and lots of shamrocks around the home and green beer and shamrock shakes and all those things, just to bring some laughter and some joy to the residents. So all the homes participated in those types of events for March. So just wanted to just sort of highlight that piece, if that's okay.
Mhm.
And I do want to talk about occupancy, if that's all right. So it is a little bit different. We don't usually talk about occupancy at these meetings because it's usually not something we need to address. But I do want to highlight that Lee Manor is in a little bit of an occupancy struggle at the moment. And so just to present some background information to make sure committee understands how it works with the ministry is as long as the home is at 97% occupancy, as we experience discharges and residents leaving the home and new people moving in, as long as we hit that 97% threshold, we're funded as though we had 100% occupancy. So that 3% variance is funded at 100%. So it's a pretty important indicator that we monitor closely. And but outbreaks can impact that quite. It can be an issue with outbreaks. People struggle. They may not want to come into a home that's an outbreak, that kind of thing. And with the outbreaks that Lee Manor did experience this winter, or spring, winter, quarter, we had a lot of outbreaks going on. March in particular was quite challenging, and it did create some occupancy challenges for us. Combine that with the acuity of residents and you know what their experience is, our move-ins and admissions is quite high this year. And so our occupancy is a little bit at risk. So we are year to date below the 97%. The ministry does have a process where if there's an outbreak that may have limited the ability to admit during that period of time, because there's an illness going on and it can be quite difficult, we have an ability that we can apply for relief for those, just a period of time for that window of time on the particular home area that was an outbreak. So it's not a carte blanche for every potential empty bed in the building, but for the areas in outbreak for that period of time. So we have done that, those requests for this quarter, which does, if those issues are approved, will push us just over the 97%. So it still looks okay. but it's certainly something to be monitoring, and it does make it a precarious situation for the year, and we need to be on top of it all year. So, I've got a very close tracking and monitoring it by a home area. At every point in time throughout the month, and particularly with the outbreaks. So I wanted to make sure that committee was aware of that, and happy to answer any questions.
Okay, thank you. Are there any questions or comments? Sounds like you have a good handle on that, Tolene.
Working hard at it. I'm not gonna.
Yes. Yes. Jen?
Thanks, Madam Vice Chair. And I'll just add that Tolene mentioned it, but there has been a significantly higher number of move-ins into Lee Manor this quarter, or even a little bit, maybe the
Last year was a
few
little bit
quarters.
high, but this year has, sorry, Jen, has been a lot.
And it sounds, maybe it doesn't sound easy, but every move-in is a lot of work. There's a lot of intentional effort and steps that go into making sure that someone's move-in is successful. And there are a number of team members that play a role in that. And so one of the things about being on top of the occupancy is working with the team members to be prepared and maybe making sure we have enough staff to be able to do move-ins as soon as possible. So we really want to avoid having, I hate all the lingo, but having empty bed days. But sometimes in a world where occupancy is at 98 or 99%, it's nice to have a day or two of extra breathing room to paint the room, turn the room around, take a breath, make sure that people can move in and do the paperwork at a reasonable pace. Under these circumstances, we need to push that. We need to really be moving as quickly as we can, still doing all those things. The room needs to be refreshed and cleaned and painted if necessary. But we really need to make sure we're getting those empty beds out to Home and Community or Ontario Health at Home, so they can be letting people know on the wait list that there's a bed available, and really trying to move that process as quickly as possible. So as leaders, we want to make sure we support our staff to have the tools and resources they need to be able to do that.
Thank you. Tolene?
Thank you, through you, Madam Vice Chair. Just to add to that, to help paint that picture really clearly, in an outbreak as well. So, we did have a pretty significant gastroenteritis outbreak. And when your staff are unwell and you've got some staff who are also not at work, we have to have a safe transition as well. So admissions and move-ins, we need to be careful about what that looks like, and we need to have the right team members in place too. So outbreak really can impact what that process looks like as well. So that's just a piece I forgot to mention. So thanks for that reminder, Jen.
Very good. And I never thought about refreshing the room or painting the room. I didn't think of it. So that's good to know. So, okay. So, Shannon, you're next.
Oh, yes, I am, through you, Madam Chair. I just wanted to add one thing, just in regards to the occupancy.
Yes.
The BSTU unit is a specialized unit, so that 97% doesn't affect the BSTU. So that's why the numbers are divided out between the home and the BSTU on that report.
Very good.
All right. So now I'll give you my report. Good afternoon, everybody. So I'm going to report on the Resident and Family Council, and to end with a colorette story as well. Resident and family members across all homes have become increasingly engaged in the meetings. Membership and participation have grown steadily, with residents also showing greater interest in attending. A contributing factor to this increased engagement is the participation of the departmental leaders, who provide updates and overviews of their roles, and this has created valuable opportunities for open dialogue, allowing residents and families to ask questions and contribute to quality improvement important discussions and decision-making processes. Meeting minutes are posted in the homes and are accessible to all, supporting the transparency and ongoing involvement of the residents and families. I believe there are so many Color It stories that are happening every day in the homes. However, the Color It story that I would like to emphasize is one from Rockwood Terrace that is in the report. The home was able to color it through opportunity by the nutrition manager, taking it upon herself to organize an intimate dining or a dinner club event, along with the assistance of the recreation department, because a resident provided her with a recipe that she was eager to try. The nutrition manager brought in her own china, tablecloth, centerpiece, and glasses to create an elegant dining experience. Specialty teas and margaritas were served. The intimate dining club event was attended by the resident who had suggested the recipe and 5 other residents. The home received a heartfelt thank you card from one of the attendees stating, "You have given me at 93 a very special highlight that I will never forget." This feedback is a true testament to Color It, showcasing the positive impact of personalized and thoughtful programming. The dedication and creativity in organizing the event highlights the importance of person-centered care and residents' quality of life. And that's my report.
That's pretty special.
It is.
Yes. Yeah. Any comments or questions? All right. Just before I call the vote, I want to confirm with the clerk, is quorum 4?
Quorum is 4, yes.
That's good. Thank you. So I will call the question. Is there anyone opposed? Seeing none, I will consider that carried. So moving on with the agenda, Jen, do we have a closed meeting or is that a placeholder on the agenda? A
That's a
placeholder.
placeholder.
Okay, thank you. We do not have any correspondence, but I will ask if there's any other business. And I don't see any hands raised. So our next meeting date is July the 3rd at 9 a.m. Are we meeting at a home? Go ahead, Jen.
Thank you, Madam Vice Chair. Yes, I believe we are meeting at Rockwood Terrace, and we'll be sorting out the details. July 3rd seemed far away, but I think it's not as far away as we thought. So we will get those details out to committee members. What we have done historically is a meeting and then we'll do a tour of the existing building. Rockwood, we haven't had a chance for this committee to tour Rockwood, I don't think, because of outbreaks. I think last year we had to switch to virtual because of outbreak season. So, and then often we will have lunch if there's interest and people have time for that. So we'll send details. And then the September meeting will be in person as well at one of the homes. And then in November, it will probably be in person at the administration building as a placeholder for budget discussions usually.
Very good. Okay, so we have one other motion, and that is to adjourn at 1:38. I need a mover and a seconder. And I'll take Councillor Hutchison and Councillor Carleton. And I don't think anyone's opposed, so we will consider that carried. Thank you very much, everyone. Have a good day.
Thank you.
Thanks.